A hearty good afternoon and welcome to our session on the topic of what is IUI. To educate us on this topic today, we have Dr. Malti Madhu among us, and she's the best person to guide us through this topic because of her extensive experience as a senior IVF and a fertility consultant. Now, Doctor, you have the stage.
Thank you. Thank you for kind introduction. Namaskar. Uh, Today I'm going to discuss about IUI, the very basics of IUI treatment, like, and we'll try to answer the questions that come to patients' mind whenever they approach a fertility specialist for IUI treatment. As we all know that IUI means intrauterine insemination, and IUI is one of the most commonly performed treatment that is offered to the couple whoever are struggling with fertility. It's a non-invasive form of treatment and one of the cost-effective treatment option also. So, what is IUI basically? IUI means a procedure in which the washed semen sample is placed directly inside the uterine cavity around the time of ovulation. So, the IUI is done just to increase the probability of fertilization of the egg by the sperm, and thereby it increases the chances to conceive. So, why IUI is done? Like conditions whenever IUI can help. Whenever a couple is having male factor infertility, means there are mild problems in the semen samples, like mild derangement of the count of the sperms, then their motility, and mild derangement with morphology. They are often told to go for IUI cycle. Then there are sexual dysfunctions like erectile dysfunction or the functions or dysfunctions of ejaculation. Then in all those cases IUI might help. Then whenever the semen sample has nil sperm and it is not possible even to retrieve sperm surgically from the testis, then in some cases donor semen is used, and in all those cases IUI can help a couple. Then all cases of minimal to mild endometriosis IUI can help. Also the polycystic ovarian cases, whenever there is a problem of an ovulation, drugs can be used to induce ovulation, and IUI is used in addition to increase the chances of conception. Then all unexplained infertility cases, whenever the tubes are patent, the semen analysis report is also normal, and there are no other identifiable factor responsible for infertility. Uh, that is often referred as unexplained infertility, and in these cases also IUI is often offered as first treatment option. Then there are cervical mucus hostility. Cervix, as we all know, is the opening of uterus into the vagina. Cervix contains cervical mucus and it acts as reservoir of sperms after intercourse. So, in some cases, the cervical mucus is too thick or viscous. So IUI can help. What we are doing in IUI, we are putting the wasp semen sample directly into the uterus through with the help of very fine cannula. So first of all, the question comes in patient's mind that is IUI painful? It's not a painful procedure, and it hardly takes, I mean, the procedure itself hardly takes 10 to 15 minutes to get completed. Then, uh, what are the prerequisites of IUI? For IUI to work, there should be at least one of the fallopian tube that should be patent and working. Then the women should be ovulating, like either spontaneously or in some cases, like polycystic ovarian disease, the ovulation can be induced with the help of drugs. Then the endometrial lining should be receptive, like it should be 8 9 millimeter in thickness, and it should be triple line, it should be receptive. The blood flow should be good around the endometrium. Then, how the couple is prepared for IUI. For IUI, there are certain blood tests and tubal patency tests that are needed before the procedure. Basic blood tests like complete blood count, then test for blood sugar, then viral markers like HIV, HBsAg, then VDRL. These tests are performed. Then, if there are symptoms of thyroid disease, then thyroid is also checked. And for male partner, the detailed semen analysis is done. For male partner, the detailed semen analysis along with culture is done. Then, often the AMH is checked. The baseline ultrasound scan of the pelvis is performed before going for IVF cycle to know that if there is any pelvic pathology like endometrial polyp or submucous fibroid, etc. If there are submucous polyp that are big in size, or submucous fibroid, or any polyp that is significant in size, like more than zero point 0.5 centimeters, then they should be removed hysteroscopically before going for IUI cycle. Then, once the couple is prepared, then they are asked to report on second or third day of cycle. And as they approach for treatment, the baseline transvaginal ultrasonography is done. That gives us information that is there any residual cyst of the previous cycle, or everything is okay to start the IUI treatment. Also, before starting IUI treatment, the tubal assessment is sort of essential. The tubal assessment can be done with the help of HSG or hysterosalpingography and SIS also. So, in hysterosalpingography is a dye test in which a dye is pretty opaque dye is passed through the cervix into the uterus through the tubes, and at the same time X-ray pictures are taken. And in SIS, the tubal assessment can be done with the help of sonographic examination. It's not, both the procedures are not painful, but a little discomfort may be there that is usually managed with the help of analgesics. So, coming back to the IUI cycle, from second or third day, some medicines are prescribed to induce the growth of oocytes in either of ovaries. The target is to grow 1 to 2 or maximum 3 follicles in the ovaries. We try to avoid formation of multiple eggs to prevent ovarian hyperstimulation syndrome and also multifetal pregnancy. So, the target is 1 to 2 development of 1 to 2 mature follicles of 18 to 20 millimeter in size. So, the periodic assessment of the growth of follicles can be done with the help of repeated transvaginal sonographic examination. So, periodic sonographic examination is also called as follicular study, as many of you must be knowing. The follicular study is generally started from cycle day 8 or 9, and it is repeated at regular intervals to monitor the growth of follicles. Sometimes, in some patients, some injections are needed to induce the growth of good quality eggs. Then, once the follicles are ready, then trigger injection is given to induce ovulation. The trigger injection is usually the HCG injection, either recombinant or urinary HCG injection, and that is administered. And IUI is scheduled around 36 to 40 hours after the trigger injection. So, once the trigger is given, then the couple is asked to report for IUI. 36 hours or 36 to 38 hours or even 40 hours after the trigger injection. Then on the day of IUI, they report to the center, and then the male partner is asked to give semen sample. The process of giving semen sample and its preparation is very important for the success of IUI. The There should be no gross derangement of the semen parameters. At least 5 to 10 million motile sperm count should be there in the semen sample. All those who are having gross abnormality of the semen parameters, like whenever the motile sperm count is like 1 million or even less than that, in all those cases IUI might not help. They should go directly to ICSI or IVF treatment. So once the male partner is instructed to give the semen sample, that part is important. Whole of the semen sample should be collected in the container, and it should not spill outside, as often the first few drops contain the sperms that have maximum motility. So that is very important. And once the sample is collected, then they are handed over to the andrologist, whoever prepares the semen sample. Semen preparation involves it's basically an act of separation of seminal plasma from the motile sperms. All the non-motile sperm particles and also the plasma is separated from the motile and healthy sperm. So it's very important that the semen sample is prepared within half an hour of the collection of the semen sample. Then, once the semen sample is prepared, it should be used for IUI procedure within 1 hour for maximum results. Then the during the process of IUI, the women like it's a normal gynecological examination. During taking all aseptic precautions, the vaginal speculum is introduced, and the washed motile sperms um, introduced into the uterine cavity through a very fine IUI catheter, intrauterine insemination catheter. The process is not painful and it hardly takes 5 to 10 minutes. Then the woman is instructed to lie for 5 to 10 minutes, and after that she can get up. She can even join her normal duties from the day of IUI. There is no need for absolute bed rest or any dietary precautions after IUI. Generally, luteal phase support is given to increase the success rate of IUI. Luteal phase support means prescription of progesterone hormones, usually the oral preparation that is given for next 15 days. So when she can know that whether the IUI is successful or not. After performance of IUI, after 2 weeks, the test for pregnancy can be done, usually the blood test, because uh, it's, the urinary HCG become positive later on. First of all, the HCG hormone can be detected in the blood. So usually the serum beta HCG is done 2 weeks after the process of IUI. Then some of the couple asked that how many cycles of IUI can be done and what is the success rate of IUI. With best of the ovulation induction drugs, and the women's age, if it is less than 35 years, there are mild semen parameters derangement, then in all those cases, the maximum IUI success rate is around uh, say 18 to 20% per cycle. And usually 3 to 4 or even 6 cycles of IUI can be done for a couple uh, if she is young, less than 35 years, and there is no gross abnormality. Whenever there are multiple factors that can contribute to infertility, then repeated attempts of IUI might not be the best option for the couple. They should consult their fertility specialist and consider higher form of treatment. Then whenever there is uh, like the problem of egg quality is there, like grossly deranged AMH level, or women ages advanced like more than 40 years, 41, 42. In all those cases, the success rate of IUI is not that great. It's around 1% after the age of 40 years. So IVF sometimes in these cases gives the best success rate. Then is the intercourse permitted after IUI? This is the question often asked by my patients. You can have intercourse whenever you feel like, because it's not like that if you are having contact, then that might interfere the IUI result. There is no effect of any dietary change or this practice uh, that interferes with the success rate of IUI. I think that's all in nutshell about the IUI. Common questions about IUI. If there are more questions, then I am happy to answer. Please let me know about that. Thank you.